dry needling. So what is dry needling? It's basically the use of what's called a fusiform needle. It's a needle that's very thin and hair-like. It's different from a syringe. That a syringe has a serrated edge. It's like if you took a straw and cut it at an angle. That's a hypodermic needle. That's something you deliver medication for. The dry needle that we use is more of a cone shape, so it doesn't tear or cut through the tissue. I mean, it's obviously going to hit some fibers, but what it does is mostly kind of spread the fibers apart, right? And that's how it drives the tissue. What you're trying to do with dry needling is you're addressing soft tissue restrictions that don't respond as well to kind of manual interventions where it's deeper in the tissue. But the things that dry needling does is it creates it's called kind of like a sterile inflammation, or it creates a pro-inflammatory response. Just through training and through competition, right? We work and we get into all these repetitive postures and we do these repetitive movements time and again. Well, that builds soft tissue. And you guys know that's why foam rolling exists. That's why the stick exists. That's why deep tissue massaging exists. That's why stretching feels good, because you do these things that make certain muscles get tighter. What the dry needling does is you can stimulate those tissues on a deeper level. And what I really like about it is we get to work on those tissues without my instructions or my correction getting in the way, and without your interpretation of what I'm saying or the way you think it should feel getting in the way. This is just the needle interacting with your physiology. And you create a pro-inflammatory response, which is basically you spark some inflammation in the body, but you didn't break down the tissue. So you start that cascade of healing, that self-healing effect. And it helps you basically recover. So a lot of things that happens also with these repetitive things during training is that your tissue kind of gets stagnant in a phase of healing. It's like it doesn't get allowed to heal before you start training again, and it starts breaking down. And then you have this stagnant form. Like there's phases of healing, and like even in hospital settings, if somebody has a big wound that's not healing, they'll go in and they'll score that tissue to make it bleed, just to spark it into to spark the healing process. Dry needling does the same thing, only it's a lot less aggressive. And then you have kind of the release of all these different chemical mediators that will. The other thing that it's really nice for is if you have like trigger points or muscle spasms, or just like hamstrings that are more so for athletes and for performance. Like my calves are always tight, my hamstrings are always tight because they're always working, right? They don't relax. It's not like you have a strain or a medical condition. You just know that if you could loosen that up, it's a lot better. You can do the dry needling into that muscle and then attach electrical stimulation to it, and you basically you reset the muscle, right? Because muscles function on electrical activity, and sometimes they have this signal going to them that says, hey, we're always using this muscle, it's always ready to go, so let's just keep it tight anyways, and it stays that way, which is nice when you're competing, but when you're just sitting and relaxing, it can be uncomfortable. You can stimulate that muscle. You can dry needle that muscle, apply some electrical stimulation, and basically reset the rest of the tolerance. So it's like instantly you turn off that signal, you reset the signal. Your brain has to deal with that input of what is going on with this muscle, and you turn down the gain on that muscle. So immediately afterwards, when we remove the needles, 5 minutes later, the muscle's just ready to stretch. And what I found is the best benefit is when you do some sort of dry needling in those conditions, and then go straight into like your dynamic mobility activities where you're stretching into it. And that muscle is in a sense more receptive. You're not fighting that. We've all had kind of a tight hamstring that you try to stretch it and it feels like you're just pulling against it. It's that moment where you just, it's like those days where the hamstring just lets go. You're like, man, why does it do that every day? So that's what dry needling does from that standpoint. So